welcome back to the channel. Today I'm diving into a topic I know a lot of you are wondering about: marathon breastfeeding. You know, those long, drawn out nursing sessions where you feel like your baby's been latched for hours on end and you're wondering, is this even normal? So before I get started, if you're new here or you haven't subscribed yet, please make sure to hit that subscribe button and turn on notifications so you don't miss out on any of my new videos. I have a brand new channel here that I'm trying to grow, and it will be really helpful. So we talk about all things motherhood here, from postpartum planning to expert newborn care tips. And my goal is to help you feel informed, empowered, and most importantly, that you're not alone on this journey. So hit the subscribe button and let's get started with today's topic. Exactly what is marathon breastfeeding? We often call it cluster feeding, but it's when your little one has these really long nursing sessions, often lasting for hours. And yes, that might mean you're sitting in the same spot nursing for what feels like forever. These are not quick little feeding breaks. These are when your baby latches on and just stays. They're in it for the long haul. And I know the big question a lot of you have is this normal? The short answer is yes. And especially in the early months, marathon breastfeeding is super common, and it can happen for a bunch of reasons: growth spurts, hunger, or even just for comfort. So babies are constantly developing and they need more calories, and breastfeeding gives them exactly what they need when they need it. It's not a linear progression. So some days they need more and other days they need less. But here's what I want to bring in: something a little controversial, because I know some of you have heard conflicting advice. Some people, maybe even well-meaning friends and family, might tell you that this kind of marathon breastfeeding means your baby is not getting enough milk. Or even worse, that by feeding them whenever they want, you're somehow spoiling them or getting them used to something that they shouldn't get used to. Okay, I am here to tell you that that is simply not true. Okay, marathon breastfeeding or cluster feeding does not mean necessarily that your milk supply is low or that your baby is too attached to you. It's usually a phase, a normal phase, where your baby needs extra time, extra connection, and perhaps extra calories. So let's talk about why babies do this. Sometimes they're just plain hungry and need that extra boost of milk, especially during those big growth spurts. And those, again, don't come, like on a calendar. They just happen spontaneously, and the only way to really know is just by responding to them, knowing their cues, reading them, and responding. So this typically happens at 2 to 3 weeks, again at 6 weeks, again around 3 to 6 months. But again, that's just a guess. If your baby's going through a growth spurt, they will feed longer and more frequently at times to help your body produce more milk to match their needs. So it's not always about food. Sometimes babies marathon breastfeed or cluster feed for comfort. If you think about it, they just spent 9 months tucked inside this cozy and warm womb, and nursing brings them close to you. It lets them hear your heartbeat. It gives them that sense of security that they crave. This is a major, major biological need, and it's not to be ignored. Cluster feeding can be as much about emotional comfort as it is about nutrition. Now, let's get to the real thing. Marathon breastfeeding is also a marathon for you, mama. So these long sessions can be physically and emotionally draining. You're sitting in one spot for hours. Maybe your back is hurting. You're getting thirsty, hungry, and let's not even talk about using the bathroom every 20 minutes. Okay, it is a lot. And if you're feeling frustrated or overwhelmed, that's totally okay. Look, take a deep breath. You're not alone. Let's talk about some practical tips that can help make cluster feeding a bit easier. First of all, find a comfortable position. For long sessions, really lying on your side or a sort of laid back reclining position is great, because they let you relax more and you're actually getting some rest. The important thing, though, is to support your arms. So make sure you have some pillows or blankets under your arms and behind your back and shoulders. That'll reduce the strain on you, and it'll help the baby's latch be a little bit more relaxed and comfortable. Keep water and snacks close by during those times. You know when they're coming. Usually it's in the evenings between 6 and 9, or between 9 and midnight. You'll get to know your baby and when they like to have that cluster feed. It is a workout for your body, so stay hydrated and stay nourished. Another big help is to set up a little breastfeeding station. It can be as simple as a basket with a water bottle, some healthy snacks, maybe a good book, or your phone. But you want everything you might need within arm's reach, because the last thing you want to do is disrupt your baby and have to start over, especially if latching is difficult. So here's something that's really overlooked, and that is self-care during cluster feeding. Self-care while you're nursing. Yes, you can practice gentle stretches to relieve muscle tension, or take a moment to just breathe deeply and check in with yourself. You are doing a monumental task here, and these little things can make a difference in how you feel during and after these long feeding sessions. So, when should cluster breastfeeding be a concern? If your baby's not gaining weight, if they seem lethargic, meaning droopy and having no energy and not being very alert when they are awake, or if they're not producing enough wet diapers, then it might be time to check in with a lactation consultant and or a pediatrician to make sure they're getting enough milk. For most moms, marathon breastfeeding, cluster feeding is just a phase that happens. It comes and goes and it fades away. So let's bust a couple myths while we're here. Myth number 1, you are spoiling your baby by breastfeeding them whenever they want. Look, babies are biologically wired to feed frequently, and there's no rhyme or reason. They're all very different. Comforting them is not spoiling them. Comforting them, responding to them, is meeting their needs. Myth number 2, marathon breastfeeding means you have low milk supply. Not true. Okay, most of the time, it's your baby's way of ensuring that your body does produce enough milk as they grow. Your body will respond to the latching and the nursing, and it will produce more milk as long as you give it the chance by latching and keeping that baby on as long as they want. So it's time to wrap this up. Marathon breastfeeding or cluster feeding can be tough, but it is normal, and it's often just what your baby needs in those early months. Remember, be gentle with yourself, find ways to make it more comfortable. Just give in. Don't try to turn the tide. It's much easier to just go with it. Don't hesitate to reach out for support if you need it. If you need to rethink things or you just need a reset, that's a good time to call a friend, talk to a postpartum doula. Just get it in your mind. The fact that you're watching this video says right here that, you're willing to give it a shot and you're doing your best, mama. If you found this video helpful, please give it a thumbs up, share it with other moms who might benefit from this advice, and don't forget to subscribe for more content. Thanks so much, and I'll see you next time. Thanks for watching. Make sure to hit subscribe and the notification bells